Hi, I'm Dr. Felipe Castillo, a cardiothoracic radiologist from the Joint Department of Medical Imaging at the University Health Network and Department of Medical Imaging and Ophthalmology Faculty of Medicine, University of Toronto. We studied how long-term exposure to common urban air pollutants is associated with coronary artery disease on cardiac CT, including the amount of calcium in the coronary arteries, overall plaque, and narrowing of the artery lumen. Heart disease is the #1 cause of death worldwide. Most people live in cities and breathe polluted air every day, so it's important to understand how higher long-term air pollution exposure relates to coronary artery disease and whether this relationship differs between men and women. We analyzed more than 11,000 cardiac CTs from 3 major hospitals here in Toronto between 2012 and 2023. Using the residential postal codes, we estimated each person's average air pollution exposure over the decade prior to CT from two pollutants: fine particulate matter, which are tiny particles produced from traffic, industry, and wildfire smoke, and nitrogen dioxide, which is a gas pollutant mainly related to burning fossil fuels. We evaluated the association of these exposures with three CT markers of coronary disease: calcium score, total plaque burden, and obstructive stenosis. We found that higher long-term exposure to fine particulate air pollution, or PM2.5, was linked with worse coronary artery disease. Each increase in PM2.5 exposure was associated with higher coronary calcium, more overall plaque, and a higher likelihood of obstructive narrowing. Nitrogen dioxide showed similar trends. We also found differences in these relationships by sex. In women, higher PM2.5 was linked with higher calcium scores and more severe narrowing. In men, higher PM2.5 was linked to higher calcium score and greater plaque burden. These differences may be explained by multiple factors, including differences in hormones and exposure patterns. The main message of this research is that air pollution is a modifiable cardiovascular risk factor with higher exposure associated with worse imaging markers of coronary artery disease. This was true even at relatively low exposure level, which is typical in developed countries currently. Thank you for listening.